Economic inequality drives disparities among people across all aspects of life, meaning that no one will ever be truly equal to one another. Economic inequality is prevalent across the entire world and in all 50 states. It happens in every country, with some cases being worse than others. According to a report published by the Economic Policy Institute in July of 2018, Connecticut ranked third in terms of economic inequality, and being from this state, I witnessed the effects of this disparity firsthand. Today, I will be explaining how inequality in economic standing creates imbalances for citizens, which I will do through discussing disparities in healthcare, safety, and in education. Economic inequality creates disparities in healthcare based upon access to good doctors and medicine, as well as the impacts of COVID-19. Economic inequality can lead to different levels of access to healthcare, making people from lower income areas not be able to get the proper medical attention they may need. Good doctors and medicine are expensive, which means that wealthier people are going to be the ones that are going to be able to afford those services. Essentially, economic standing is gatekeeping those from lower income areas because they do not have the same access to good healthcare, which is what drives the disparity. The coronavirus pandemic is a good example to show how economic inequality drives healthcare disparity based upon the access to testing and the ability to quarantine. According to an article written by the Los Angeles Times on May 26, 2020, COVID-19 rates in lower income regions of Los Angeles were much higher than they were in higher income regions. Their research shows that near the end of May, wealthy communities such as South Bay and West Side were averaging at about 300 cases per 100,000 residents. However, in lower income areas such as South LA and Central LA, they were averaging over 600 cases per 100,000 residents. The data represents the idea that citizens from lower income areas are much more likely to get illnesses such as COVID-19 because they do not have the proper means to get tested, to socially distance, or to receive treatment if they do get sick. Thus, economic inequality leads to disparities in healthcare, putting those from lower income areas at higher risks of getting sick and not having the resources to help them get better. Now that I've talked about how economic inequality creates disparities in healthcare accessibility, I will move on to discuss how economic inequality affects public safety. Economic inequality drives disparities in safety between areas of different income, leading to higher crime and less access to safety measures in lower income areas. According to the U.S. Department of Justice report from 2012, the rates of violent victimization were much higher in lower income areas than they were in higher income areas. The statistics in the report show that those from lower income experience victimization at about 40 per 1,000 people, while high income earners experience victimization at about 16 per 1,000 people. These results show that areas of lower economic standing are much more likely to experience violence and crime in their areas, driving disparity in the safety levels between low and high income areas. With increased crime rates in lower income areas, citizens should have an increased amount of home security systems. However, that is not always the case. Typically speaking, home security systems can be very expensive, which means that those from higher income areas are going to be the ones who are able to afford them. But based upon the higher crime rates in lower income areas, they're the ones that are in more need. Therefore, the disparity between high and low income areas in terms of safety can be seen with the increased crime in lower income areas, which makes them not as safe. Now that I've talked about how economic inequality impacts safety, I'll discuss how the disparity has an effect on education. Economic inequality creates differences in education because children from lower income areas generally only have access to public schooling, and students from these areas are also less likely to graduate. In my county back home in Connecticut, we have areas of both high and low income. A common theme in the higher income areas is that they have more private high schools where the tuition is very expensive to attend. However, this is not seen in lower income areas, which leads to the students only having the option to attend public school. In addition, students from different areas of income also face differences in education based on graduation rates. Pete Musto wrote an article for Voice of America on November 7, 2017, in which he talked about rates of graduation in different income areas. In this article, he states that about 60% of wealthy students complete their studies and graduate, while only about 16% of low-income students graduate. These statistics show that significantly more students that come from higher income end up actually graduating, while only a small percentage of students from lower income areas are graduating. Therefore, there is a clear difference in education between higher income and lower income. In conclusion, economic inequality is prevalent all across the country, and it impacts many, many areas of our society. The issue of economic inequality is incredibly important because it affects people in many different areas, such as healthcare, safety, and education. Economic inequality is a major issue in our country as it impacts everyone, no matter who they are or where they grow up.